National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. One of the most common presenting symptoms in my office is nausea and vomiting. I work with a lot of people with a lot of very serious conditions, and I do a lot of work with digestion and intestinal conditions, and therefore I see a lot of people that suffer from chronic nausea, often associated with vomiting, right down to a very severe condition called cyclical vomiting syndrome. And it's a very debilitating condition when people have it, and there's a lot of reasons why people can have chronic nausea and vomiting. Some of the main causes behind it are infection. Anybody who's had the flu may have experienced this before, so that's a very common cause. Now, not all infections are viral. They can also be bacterial infections. So anybody who's experienced food poisoning has experienced, probably acute nausea and vomiting symptoms. Other reasons we can have nausea and vomiting, well, pregnancy is one. Not one people often think about, but a lot of the hormonal changes that occur with pregnancy actually induce a nausea and vomiting response in women. We often lovingly call it morning sickness, although many women who've experienced it know that the morning seems to last 24 hours a day, 7 days a week. It's just the sickness of pregnancy. So that's another reason why you may have nausea and vomiting. Then of course there's inner ear problems or ear infections. The reason behind that is what we call the vestibulocochlear apparatus, or the part of your body that deals with balance. And when balance gets off, if you get excessively dizzy, you may find one of the side effects of that is you get nauseous. So sometimes inner ear infections can actually result in nausea and, in severe cases, vomiting as well. So those are just some of the reasons why you may experience these symptoms. And again, nausea and vomiting in and of itself, not a disease. These are symptoms like a headache of something else going on in the body. So ways we can help to manage them. Well, obviously the cause is going to be important. If it happens to be nausea and vomiting because of pregnancy, often what I recommend is really high dose vitamin B6 as well as some minerals. There's actually a drug often used for this treatment called deplete, and it's actually just an antihistamine with some magnesium and B6 with it to help aid in the management of the nausea. And for a lot of women, I find just B6 and magnesium alone, or B6 and a multi-mineral alone, are more than enough to manage the morning sickness symptoms without some of the effects that an antihistamine can create, some of the side effects like drowsiness that people may find as a reason they don't want to end up taking the medication versions. So if it is pregnancy, look into talk to your doctor and look into supplementing with those nutrients, because it may be a very effective way for you to manage your morning sickness or your sickness of pregnancy symptoms. Now, if it's due to an infection, obviously identifying the cause is going to be important. If it's a viral infection, how we treat viral infections are very different from bacterial infections. So something like food poisoning is going to have a very different impact on your system, and your body's going to react a little bit differently. And treatment, of course, for a viral infection, what we're going to use, things like elderberry. It helps prevent viral replication, helps our body manage a viral infection more effectively. But really, we pretty much just have to wait it out. So it's really important if you do suffer, especially excessive vomiting with that, what you're going to do is want to take in a lot of fluids and a lot of electrolytes to just prevent the dehydration that can come with excessive vomiting. And what I usually recommend to people is drink a tablespoon at a time. When your stomach is upset, if you drink too much, you're just going to bring it back up. Now, if it's a food poisoning issue, that's going to be a little bit different. One of the things I often recommend, in addition to, of course, some treatment for whatever bacterial infection you may have gotten, is to use a probiotic. One of the reasons for that is the probiotics are the healthy bacteria that inhabit the stomach and the intestines, and what they do is help prevent that bad bacteria from taking hold and causing a more serious or longer acting infection. Now, other things you can do as anti-nauseants, take in ginger. Ginger contains a variety of chemicals called gingerosides. Gingerols. They're very effective at managing symptoms of nausea. And ginger is one of the classic remedies for nausea. So very big fan of ginger. You can eat ginger root, you can have dried ginger candies, there are ginger pills, or you can even make teas out of ginger, a variety of ways to get it into your system. Obviously, I recommend the teas a lot, especially if people are vomiting, because it's one way to start to help rehydrate them. As well, I also often recommend peppermint tea. Peppermint helps calm the nervous system in the intestines. We often think of peppermint as very invigorating, giving us energy, but one of the other things peppermint does is it does calm down the nervous system in our intestines, and that can help reduce nausea and vomiting symptoms as well. So if somebody has problems with stress vomiting, which is another cause, so excessive stress can lead to vomiting, managing the adrenal response using ideally adrenal glandulars can be very effective, but often what I find is they need herbs more like holy basil, lemon balm, and peppermint, which are very effective at helping to manage the stress response, at the same time calming down the nervous system in the intestine to prevent stress vomiting. The nervous system in the intestines is the largest in the body. If you rolled it up into a ball, it'd be bigger than your brain. You've got more nerves in your gut than you do in your entire spinal cord. So it has a very profound effect on the action of the intestine. So excessive stress can lead to just a change in how the nervous system in the gut works, and it can cause it to basically work in reverse and cause nausea and vomiting. If you do suffer from nausea and vomiting, make sure you figure out and identify the cause behind it, and then once you do, I hope I provided a few beneficial tips for you to help manage your symptoms. So check out more of our videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.